Spotting during the 2-week wait is one of the most common questions I get. Today we're going to talk about what it means, what it doesn't mean, and when you should check in with your specialist. So first we're going to talk about what spotting commonly means. First, you should know that it doesn't necessarily mean that something's wrong, and it also depends on if you have spotting every cycle or if it's an occurrence that happens randomly. So one thing it could mean is that there's hormonal changes, and this can cause spotting. It could be implantation bleeding. Usually with implantation bleeding, you get just light spotting. It tends to be more brown or pink in nature, but even implantation bleeding can sometimes be a bright red, but it usually only lasts for a few days. Just to be clear that if you don't have implantation bleeding, it doesn't mean that you're not pregnant. So that's the other thing that sometimes alerts people and confuses them. Sometimes spotting in the luteal phase, which is the transition after ovulation while you're waiting to find out if you're pregnant, can also be from the cervix. It doesn't necessarily mean it's from the uterine lining. And that can happen after intercourse, maybe not even the same day, but days later. It can be from irritation of the cervix or hormonal changes from the cervix. And it can be from protrusions out of the cervix called polyps or polyps in the uterine lining. Other abnormal tissues, such as endometriosis, is more likely to cause spotting in the what we call luteal phase as well. Although this can occur throughout the cycle, you do tend to see it right before the period starts in women who have endometriosis, and it does tend to occur more consistently in those patients. If you do have spotting consistently every cycle, then you want to really monitor it to see how heavy it is, if it's bright red, if it's dark, and if it's happening every cycle and you need to wear a pad, then these are the things you want to make sure you have evaluated, because that's not typically normal. So spotting in the 2-week time frame can also be related to hormonal problems such as progesterone imbalance, estrogen imbalance, or thyroid hormone problems. Hormones like progesterone can be imbalanced due to a condition called polycystic ovary syndrome. Sometimes you see this with aging ovaries as well. You might not have production of enough progesterone or even necessarily enough estrogen. And as these hormones fluctuate, you can get shedding of the uterine lining, and that presents as spotting. The other thing sometimes you see with thyroid imbalance, the hormones are disrupted and we have irregular cycles or just spotting in the mid-luteal phase. We did touch on structural problems. In addition to the polyps and the endometriosis, sometimes you can have fibroids, which are overgrowth of muscle tissue. Typically when you have fibroids, which are overgrowth of the muscle of the uterus, when they're in the actual thick part of the uterus, not in the cavity of the uterus, they don't cause bleeding. But when they enter the uterine cavity space, they can start to cause bleeding. This usually occurs throughout the cycle, but it may be more frequent at certain parts of the cycle depending on the hormonal environment. So how do you know when to get evaluated and what should you be looking out for? You want to keep a log, a diary, and look for how many days are you spotting. If it lasts for more than 2 to 3 days, if it happens every cycle, if the bleeding is bright red, if you need to wear a pad, these are reasons to have your doctor evaluate you. Typically, you want to have some imaging done, some hormone levels checked, and make sure that there's nothing specific that might be causing it that can be corrected. Especially since you're trying to conceive, you don't want to wait too long to have the spotting evaluated because you might identify something that can explain why you're not able to get pregnant. And in that case, it might be something that's correctable that can lead to successful pregnancy. So definitely talk to your doctor if you've noticed this spotting for several months and if you've been trying to conceive for more than 6 months. Spotting can be confusing and it can sometimes lead you to think that you might be pregnant, which is not always the case. And in fact, as we talked about earlier, not having spotting doesn't mean that you're not pregnant. But if you're ever concerned, and if this occurs frequently, say every month for more than 2 to 3 months, or even sporadically throughout the year for more than 2 to 3 months, you probably want to talk to your doctor at least to have some testing to make sure that there's nothing that's correctable. Spotting during the 2-week wait can be emotional, but if you're ever unsure, don't hesitate to reach out.